Good evening, everybody. This is Nurse Eunice with Florida Training Academy. And in tonight's video, we're going to be reviewing questions about caring for post-operative patients. And we'll get started in about 10 seconds. All right, so let us begin, everybody. Number one, what is the most critical vital sign to monitor in a post-operative patient? Is it A, blood pressure, B, temperature, C, heart rate, or D, respiratory rate? Good evening, Anne-Marie. And whenever you're thinking about this one, I know it's so tricky, Chrissy, because normally we focus on blood pressure. But whenever it's somebody who is post-operative, think about sedation, think about anesthesia. So something that I want you to also focus on in addition to the blood pressure is the respiratory rate, you all. So this one's a little bit tricky. So the respiratory rate is the most critical vital sign to monitor in post-operative patients, as it can indicate complications such as respiratory depression or inadequate oxygenation. So yes, we usually have the pulse oximeter, the machine that measures the O2 saturation on all your patients who are post-operative. But in addition to that device, we need you counting their respiratory rate. And that will usually change before the blood pressure changes. So whenever your person is, you're monitoring them, you want to be concerned about their ABCs, and you'll learn this in nursing school. The ABCs are some of the priorities that we are concerned with when you are taking care of the patients. Airway first, breathing, and then circulation will be third. So that blood pressure would be the next thing you'd be concerned about. So great job, team. Number two, a post-operative patient suddenly becomes confused and restless. What should the nurse and assistant do first? Notify the nurse immediately. Reorient the patient. C, reassure the patient and offer a warm blanket. D, check the patient's blood pressure. Yes, Janelle. Yes, Pisces. Yes, Chrissy. Because you all are so smart and you know that whenever someone becomes confused, you want to notify the nurse immediately. That is a change in their level of consciousness, a change in their condition. And sudden changes in mental status in post-operative patients could indicate serious complications such as hypoxia or low oxygen levels or delirium. For example, we had a patient who, because she came into the hospital emergently, she didn't let us know that she was allergic to an antibiotic. And of course, we gave her that antibiotic during the surgery, or at least afterwards. And so she was extremely confused. And it took a while for us to figure out the causing action. But as a CNA, you're there at the bedside. So if you notice something that's not right about your patients, you're going to monitor them, and you're also going to notify your nurse. Number three, team, which of the following interventions should the nursing assistant implement to prevent post-operative complications related to immobility? A, assist the patient to ambulate as soon as possible. B, keep the patient in bed to conserve energy. C, limit fluid intake to decrease the need for bathroom trips. Or D, apply pressure stockings to both legs. How do we prevent complications with immobility? Yes, everybody has the right answer. So, if we want to prevent complications with immobility, we need to help make our patients mobile. And that answer is going to be A. You're going to assist the patient to ambulate as soon as possible because it helps prevent complications such as blood clots, pneumonia, and pressure ulcers. So, you all, great job. I see so many correct answers. Number four, how often should the nursing assistant assess the surgical drain of a post-operative patient on POD number two? POD, post-operative day. So this isn't the first day. This is the second day. Your patient should be more stable now. How often do you want to look at that dressing? I see some mixed answers. I see some mixed answers. And so I'm going to say pretty much every time you go in to do your vital signs, and if they're stable, vital signs are usually about every 4 hours. So it could be A or D, but A and D, not just A or D. So I'm going to say at a minimum every 4 hours, and then when requested by the nurse. And so I want you to look at this image here. We have a person who is post-op, but they also have a surgical drain. And so you're just not checking the dressing itself. You also want to be checking that drain also, because as a patient care tech in a hospital and some CNAs, depending on where you're located, you have to empty that bulb. You have to empty that drain, and you want to empty that whenever it's half full or at least at the end of your shift. So make sure you're doing your complete assessment at least 4 hours, and that's you looking at that drain. And yes, your nurses are looking at it also, but if you're a good patient care tech or a good CNA, you're going to catch things before I will. All right, number 5, the nursing assistant notices that a post-operative patient's urine output has significantly decreased since surgery. What should the assistant take or do? What action should the assistant take? A, encourage the patient to drink more fluids. B, document the finding and continue to monitor. C, notify the nurse. Or D, measure the urine output again in 4 hours. Significant decrease in urine. Yes, yes, yes. Great job, team. It is C. Oh my, this patient isn't making much urine. Notify the nurse immediately. Decreased urine output postoperatively can indicate kidney dysfunction or dehydration and requires prompt evaluation. And so my rule of thumb as far as like urine output, especially if the person has a catheter, is every 2 hours when you go and you turn your patient, just take a peek at the back to see if there's more urine being produced. If you're in the ICU, usually you'll do those checks about every hour. But if you have multiple patients, pretty much whenever you make your rounds to reposition your patients, look at the urine then. Number 6, which position is most appropriate for a postoperative patient to promote optimal lung expansion? A, supine or flat with a small pillow under the knees. B, prone, which is on their stomach with the head turned to one side. C, semi-Fowlers with the head of the bed elevated 30 to 45 degrees. Or D, side lying with the pillow between the knees. Everybody got this correct. I am so proud of you. It is C, semi-Fowler. So that's more of a reclining position with the head of the bed elevated. It helps to facilitate lung expansion and ventilation. Number 7, during handoff, the previous nursing assistant mentions that the post-operative patient received pain medication 2 hours ago and is resting. What should the nursing assistant do? A, do not check on the patient because he is sleeping. B, document that the respiration rate is 16 breaths per minute without really counting the respiration rate. C, assess the patient's pain level when taking the vital signs. Or D, ask the nurse to assess the patient's pain management plan. I see some C's, I see a D, and you all, the correct response is C as in cat, because pain is also referred to as the 5th vital sign. So even though the person's resting, when you go in and you check the blood pressure, and the rest of the vital signs, you want to also do their pain assessment. And if they're resting, you can even indicate that. So they may not be able to give you a number from 0 to 10, but you can literally chart that the person is sleeping. So pain reveals a lot about a patient's health, which is why it's often called the 5th vital sign. Not only does pain affect a person's physical health, but it also affects their mental health and quality of life on things such as mood, activity, sleep, hygiene, appetite, and the ability to focus or concentrate it, which is why when your patients are in pain, sometimes they're not as nice because it affects their mood. Question number 8, which of the following actions is appropriate when assisting a post-operative patient with coughing and deep breathing exercises? A, provide a pillow to splint the incision site. B, encourage the patient to breathe slowly to avoid discomfort. C, instruct the patient to hold their breath for as long as possible. Or D, demonstrate how to take slow, deep breaths using the diaphragm. Hey, Eunice, this one's tricky. It's not A. Yes, Jing. Yes. So for you all, it is D. Yes. So the incentive spirometer is a device that your patient should have at their bedside if they have respiratory problems or if they are post-op. And you don't actually blow in it. It requires that they take a slow, deep breath. They want to breathe in, incentive. And when they do so, it's going to be painful initially because they're exercising those lungs. And so you want to encourage them to use their incentive spirometer like every commercial break if they're watching TV, and to do it about 10 times. And there's a little gauge where we have our goal, which is usually about 2,000 mLs. But let's say that they're only able to pull 500. That is fine. Every time you go into the room, just remind them to keep using it. And I can guarantee you that they're going to get better and better. And that's going to improve their lung expansion and make them less likely to develop pneumonia. Number 9, a post-operative patient complains of sudden chest pain and difficulty breathing. What should the nursing assistant do first? A, notify the nurse immediately. B, reassure the patient and provide oxygen. C, elevate the head of the bed. Or D, offer a warm blanket to the patient. Yeah, this one was too easy for you all. It is A, notify that nurse, because that could be the sign of something that would cause more injury to your patient. And so I should have warned you. You all, this is an image of a real blood clot, pulmonary embolism. It is blood clot that's actually shaped in the form of the branches of the lungs. And so whenever a person's having severe pain in the chest, it could be because they're having a heart attack, but it could also be because of pulmonary embolisms or other serious complications that require medical attention. So yes, they can go in, they can remove those clots, but you notifying your nurse, who will then notify the doctor, we get that chain moving, and we can try to determine what's causing that patient's chest pain. And I do apologize. I should have warned you about this image, but it's like this is the only one that's kind of disturbing. All right, number 10. Which of the following is a priority intervention for preventing surgical site infections in a post-operative patient? It's not A, because my CNAs cannot administer antibiotics. So is it B, keeping the surgical site clean and dry? C, applying heat pads to the incision site? Or D, encouraging the patient to scratch around the incision for relief? Yes, Eunice, it looked like a chicken foot. You all have it. We want to make sure we keep those surgical sites clean and dry. And so keeping the surgical site clean and dry is essential for preventing surgical infections by minimizing the risk of bacterial contamination. And if you have not subscribed to our channel, I would love for you to do so. My name is Nurse Eunice, and I come on here 3 days a week and just provide you all with some questions, because so many of you all have already passed your CNA test. I want to provide questions for those who are on the next level, whether that's you trying to get ready for nursing school or that's those who are ready to work in the hospitals and the ICUs and the ERs. And we call those patient care techs. All right, so let's go to question number 11. Which of the following symptoms should the nursing assistant report immediately to the nurse for a post-operative patient? A, mild redness and swelling at the incision site. B, a temperature of 99.5 degrees Fahrenheit. C, sudden onset of severe abdominal pain. Or D, complaints of nausea after eating. Which one do you report immediately? And Jean, Alicia, Mega, Nadej, Lisa, you all have the correct answers. It is C. And so here we see this abdomen is distended. You all, sometimes your patients after surgeries, they need to pass gas. And so when you call me in the room, of course, I'm going to have the pain medication there, but I'm going to get that patient up and take them for a walk. And if they can release that flatulence, it will help their stomach pain. So that's another reason why we don't want patients after surgeries babies just staying in bed all day because they can't remove that excess gas. And if they can't, it makes it very uncomfortable for them. Question 12. How should the nursing assistant position a post-operative patient to prevent pressure sores? A, keep the patient lying on the affected side. B, encourage the patient to lie flat on their back. C, turn the patient every 2 hours. D, limit the use of pillows under bony prominences. And a bony prominence is anywhere where bone is touching bone or bone is touching bedding. So, do you want to put a pillow under someone's backside? And you all, correct answers. I see them. You're going to turn them every 2 hours. You're going to reposition them, and it helps redistribute the pressure and prevents pressure sores from forming. Question 13. Which of the following interventions is appropriate for a post-operative patient experiencing nausea and vomiting? So someone's post-op and they are throwing up. Do you A, encourage the patient to eat a large meal? B, turn the resident onto his side? C, offer the patient a warm bath? Or D, limit fluid intake to avoid exacerbating the symptoms? They are vomiting. What do you do first? Joseph? I know Alicia and Mega is tricky, but they're vomiting. So it's kind of, we're worried about limiting fluids after we protect their airway. So the best thing to do is B. We need you to turn them onto their side. So great job, team. Putting someone in the recovery position or the sideline position will help keep their airway open and clear. It also ensures that any vomit or fluid won't cause them to choke. So let's first protect their airway. And then after that, we can notify the nurse and limit their fluids. Number 14, the nursing assistant observes a post-operative patient's wound drainage to be bright red and steadily increasing. Uh-oh. What should the nursing assistant do? I don't even have to read these. You all should know the answer. Bright red and increasing above your pay grade. I need for you to notify that nurse. We need that nurse in the room. Yes. So you're going to notify the nurse immediately because bright red, drainage or blood, that actually indicates active bleeding. And you want that nurse in there because we may have to send that patient back to surgery. Who knows? Question 15. What is the primary purpose? Oh, you all know this one, of using an spirometer in post-operative patients. Remember that device I just showed you all? And they're supposed to take a deep breath in. Why do we have them do that? Is it A, to promote relaxation, B, to prevent pneumonia, C, to assess lung function, or D, to improve appetite? I'm doing my little nurse happy dance over here. And you know what? I'm going to take both of those answers. I think you all are correct. I think it is B and C. So forgive me on this next slide because I'm just going to have B listed, but you all are absolutely correct. You want to use the spirometer not only to prevent pneumonia and atelectasis, which is collapsing of the lung, but it also to assess the lung function. So I guess they're saying it's not the right one because CNAs usually don't assess the lung function. But in this image here, it looks like where I have the arrow, when you see that white area on the x-ray, that is a fluid accumulation, aka pneumonia. And so whenever you have them use the spirometer, you're preventing pneumonia and atelectasis. The spirometers help to expand the lungs and prevent respiratory complications after surgery. So we know it's painful for the patients, but I need you to still encourage them to use it. So for this one, I'm going to backtrack. It's still B as the correct answer. All right, number 16. Which action is appropriate when assisting a post-operative patient with oral care? A, brushing the patient's teeth vigorously to remove all debris. B, providing mouthwash containing alcohol for antimicrobial action. C, using a soft toothbrush to clean the patient's mouth and gums gently. Or D, skipping oral care to avoid discomfort for the patient. Yes, we are not going to skip oral care because they have been intubated probably when they receive anesthesia. So you don't want to skip the oral care. You want to use a swab. You want to use something that's going to be gentle to clean the resident's gums and teeth because maintaining oral hygiene helps to prevent other infections such as respiratory infections. Number 17, which of the following signs indicate adequate hydration in a post-operative patient? And just because they're post-operative and they could be NPO, which means nothing by mouth, don't forget that your nurses still have IV fluids infusing or that they could have had fluids infusing during the actual surgery. So with that thought in mind, does dry mucous membranes indicate adequate hydration, increased urine output, sunken eyeballs, or decreased skin turgor? What indicates adequate hydration? I see answers all over the place. But Lisa, you are correct so far. Eunice, you are correct also. So whenever someone has increased urine output, that's usually because they have hydration. They've received fluids, whether it was intravenously or orally. So, increased urine output indicates adequate hydration as the kidneys are functioning appropriately to excrete the excess fluids. This is a long one. Let's see. A post-operative patient is experiencing difficulty in sleeping. What intervention should the nursing assistant implement? A, provide a cup of caffeinated coffee before bedtime. B, administer a sleep-inducing medication without consulting the nurse. C, encourage the patient to engage in relaxation techniques before bedtime. Or D, keep the lights on in the patient's room throughout the night. Yes, everybody. They're in an unfamiliar environment. They could have anxiety, but you, as the CNA, can do things that don't involve medication to help relax your patient. So, encouraging the patient to engage in relaxation techniques, such as maybe reading a book. If they need more warm blankets, because sometimes the facilities are cold, but anything you can do to relax them. And if they can have oral intake, we usually don't give them any caffeine before bedtime, but you can give them some hot chocolate. Okay, so there are other things we can give them to make them comfortable before they go to sleep. Number 19, which of the following actions is appropriate when transferring a post-operative patient who is non-weight bearing from the bed to a wheelchair? Non-weight bearing means they cannot stand on their own. Is it A, lift the patient alone to demonstrate strength? B, use a mechanical lift device if available? C, pull the patient quickly to avoid strain? Or D, ask the patient to stand up independently? And everyone has this answer correct. You can use a mechanical lift. Using the devices reduce the risk of injury to the patient and the nursing assistant. And I want you to look at this image. I don't care what your facility says. It takes two of you all to use a Hoyer lift. One actually works the device and one has their hand on the patient. So you as a CNA should never use a Hoyer lift alone because you can cause injury to your patient. Number 20, which of the following is a priority intervention for preventing deep vein thrombosis or DVTs in a post-operative patient? A, applying cold packs to the lower extremities. B, keeping the legs elevated above the heart level. C, applying sequential compression devices, also referred to as SCDs. Or D, encouraging the patient to cross their legs while sitting. D is my pet peeve. Go around from room to room telling patients to uncross their legs, uncross their legs. So it is not D. Yes, Mega. Yes, Eunice. So you all have, once I show you the image, you're going to know what the devices look like, but we don't use cold to prevent blood clots, because actually whenever something gets cold, it slows down blood flow. So you would not apply cold packs to someone's legs if you're trying to prevent blood clots from forming or DVTs. So the correct response is C. You're going to apply those sequential compression devices. Those are the leg massagers. And so it is a method of DVT prevention that improves blood flow in the legs. They're shaped like sleeves that wrap around the legs and inflate with air one at a time. This imitates walking and helps to prevent the blood clots. So your patients don't like using them, but when they're in the bed and they're post-op, SCD's on. Number 21, which of the following activities should the nursing assistant encourage a post-operative patient to perform to promote circulation in the lower extremities? All right, so we want to prevent pneumonia and we want to prevent blood clots. That's like the main goal in effect, and infections. Those are the main three goals for our post-operative patients. So how do you promote circulation in lower extremities? Do you want the patient to cross their legs? Do you want them to keep their legs elevated? Do you want them performing ankle pumps, or do you want them avoiding movement to conserve energy? I'm doing my nurse happy dance. I see a couple of correct answers. And on the next screen in 3, 2, and 1. Ankle pumps, you all. Yeah. So it's like when they're in the bed, you have them press on the gas pedal, press on the gas pedal. So performing the ankle pumps and leg exercises will also help to promote circulation and prevent blood clots in the lower extremities. So remind them to keep moving their legs, even if they are in bed and can't get up and walk at that moment. 22. What should the nursing assistant do if a post-operative patient reports feeling dizzy when standing up? A, document the finding and continue with care. B, assist the patient back to a seated or lying position. C, instruct the patient to walk around to improve circulation. Or D, administer pain medication to alleviate dizziness. Alicia, Pisces, and Jean. Lunide, Paula, correct. It is B. Get that patient back in the bed. First, before you even stand them up, you want them to dangle at the side of the bed, as this image indicates, because we want to give their blood pressures time to stabilize. If they stand up too quickly, the blood pressures are going to drop. So asking a resident to get back in the bed will help prevent the fall and also help to prevent further dizziness. And if sitting up in the bed doesn't work, you lay them down in the bed. Of course, you call for the nurse. And if you have the equipment nearby and you don't have to leave the patient, go ahead and put the blood pressure cuff on. That way, by the time the nurse gets into the room, we have a set of vital signs. Next, 23. Ooh. Which of the following symptoms should the nursing assistant report immediately to the nurse of a post-operative patient? A blood pressure of 120/76, a blood pressure of 82/46, respiratory rate of 13, or if the resident or patient is feeling warm to touch. Which do you report immediately? I couldn't trick one of you all. Great job. So a normal respiratory rate is 12 to 20, so it would not be C. But that blood pressure of 82/46, something's not right. So we call that POH, or post-operative hypotension. Hypo meaning that it's lower than normal. And that refers to hypotension occurring on the remaining day of surgery and during the first days after surgery. And hypotension is usually when the blood pressure is lower than 90/60. If the blood pressure gets too low, it can cause dizziness, fainting, or even death. So, as we said in the other slide, you would get that person back in the bed, keep them in the bed, and when your nurse comes, she may have you put the patient in Trendelenburg position. Trendelenburg is when we have the patient's legs higher than their heart, so we turn the whole bed so that the legs are higher than the head. But you only do that when the nurse tells you to do so. But that's one of the reasons for the Trendelenburg position, so we can take the blood from the legs and send it back towards the heart and the brain. 24. This is our last slide, you all. If you enjoyed this video, you should A, subscribe to the channel, B, like the video, C, share this video with a friend, or D, all of the above. All right, revealing the correct answer in 3, 2, and yes. So, you all, we are so close to having 500,000 subscribers. Who would have known that a crazy little nurse from Jacksonville, Florida, getting on here and teaching on video what I do in person all day, would be able to help so many people. And so, whenever we get to our 500,000th subscriber, we're going to have a giveaway. We're going to have some cash giveaways, and we're also going to be giving away free items. And so I think we're about 40,000 subscribers away from making a 500,000 subscriber mark. So I just want to let you know how much I appreciate you all and thank you all for joining in our review. And I will see you all, I think, on Sunday. So bye, everybody. Have a great evening.